Hi, welcome. I'm Randy Wong. I'm a retina specialist located in Northern Virginia, just outside of Washington, D.C. Today we're going to show you a floater-only vitrectomy using a 25-gauge system in a patient who has had previous cataract surgery and a PVD. I've already initiated the operation. The 3-port 25-gauge system has already been installed, and you can see the copious floaters. And if you look real carefully, you can determine that he has already had a PVD. This is a great demonstrative video because you can really see the density of the opacities and the rather large, strange shapes that they portray as shadows on the retina. Once the vitrectomy started, and I want you to watch throughout this video, notice that the vitreous or the vitrectomy tip does not get near the surface of the retina. And this is really important because there's so many of you that write in with concerns about floaters located in the macular bursa, whereas you can see right there are floaters right in front of the macula, but throughout the length of the video you'll never see the vitrectomy tip go toward the surface of the retina or even get near it because I don't have to. This is especially true in cases where there's a PVD, such as in this patient. And what I tend to do is I start in the center and then I will move circumferentially around the eye, getting farther and farther out to the peripheral retina. And with time, after just a couple of cycles, I should be able to remove all the vitreous in the posterior aspect of the eye and most of the vitreous out to the peripheral retina. You can see that wispy substance which is left there, which is remaining vitreous, and in a short while most of that will be gone as well. Now, I've only gone around the eye really once, and then I may go around a second time to get a little bit closer to the anterior portion of the retina. Notice in just a few seconds or a few minutes, most of those dense opacities or floaters are already gone. And you're losing view here because I'm really torquing the eye over to the side so I can get my instruments way out there so that most of the vitreous is gone from the visual path. And compared to a couple minutes ago, look how clear the pathway is, or the visual axis is. I'm going to try and get a little bit more vitreous, and then I think we're going to be just about done. Now, what I didn't show in this video is that once the instruments are removed, I'm going to depress the eye 360 degrees to look for any tears that may have been either undiagnosed at the time of examination or created during the operation. But look how clear that vitreous is, and the visual axis is nice and clear. Special thanks to Brooklyn Duo for the use of their music. I'm Randy Wong, Retina Specialist, Northern Virginia, Washington, D.C. See you next time.